Is a pap smear the same thing as a pap test? Yes. A pap smear, also referred to as a pap test, is a screening tool that helps your doctor to look for abnormal cells in the cervix that are cancerous or have the potential to become cancerous. Where is the cervix located? The cervix is the lower portion of the uterus, which is part of the reproductive system, also known as the womb. The cervix is like a passageway that connects your vagina to your uterus. What role does the cervix play in a woman's body? You can think of the cervix as a door that opens and shuts as it allows fluids to both enter and leave the uterus. During intercourse, it opens to allow the sperm to enter the uterus in order to fertilize eggs. During menstruation, it opens to allow blood from the shedding uterus lining to flow out through the vagina. During pregnancy, the cervical mucus forms a plug, of which prevents bacteria and viruses from entering the uterus and harming the fetus. During childbirth, the cervix dilates, widens, in order to enable the birth of the baby. The cervix also produces discharge in order to keep the vagina clean and healthy. This discharge also helps to prevent bacteria from entering the uterus. When should a woman get a pap smear? The American College of Obstetricians and Gynecologists recommend the following schedule. Women ages 21 to 29 should get a pap test every 3 years. Women ages 30 to 65 should get a pap test combined with an HPV test every 5 years. Women after the age of 65 are no longer required to get a pap test as long as their last 3 pap tests were normal. This is a decision, however, that should be made between you and your physician. I'm not sexually active, so should I still get a pap smear done? Yes. Although most cervical cancers are caused by the human papillomavirus, not all cancers come from HPV. Additionally, HPV is not always contracted through having sexual intercourse. In other words, you can still get cervical cancer if you don't test positive for HPV, and/or you can still get HPV if you aren't sexually active. Is a pap test and an HPV test the same thing? No. A pap test is looking for cancerous or precancerous cells, so any changes to the cervical lining that are abnormal, whereas an HPV test is looking for the human papillomavirus, which can lead to cervical cancer. Can a pap test and an HPV test be performed at the same time? Yes. Although they can be performed at the same time, each specimen is put on its own slide or in a vial, depending on which method your doctor uses, and sent to a lab for a cytologist to look at under a microscope. Is a pelvic exam and a pap smear the same thing? No. A pelvic exam is routinely performed, usually during your annual gynecological visit. During this exam, your doctor is checking the size and shape of your uterus and ovaries to note any changes and is looking for any tender areas or abnormal growths, whereas a pap smear is looking for changes in the cervical cells that might be cancerous or precancerous. Does a pap smear hurt? Both the insertion of the speculum and the pap test and/or HPV test should not be painful. However, you may feel a little pressure. The exam and pap should only take a couple of minutes to complete before you'll be on your way. As Benjamin Franklin once said, an ounce of prevention is worth a pound of cure. So in other words, a few minutes of discomfort is worth preventing cervical cancer or curing it before it's too late. Can a pap smear show more than just cancer? Yes, a pap test can show any abnormalities found in the cells, including a bacterial or yeast infection, inflammation, the human papillomavirus, or other changes related to aging or menopause. Does an abnormal pap smear automatically mean you have cervical cancer? No. In fact, of the around 3 million pap smears that come back abnormal in the United States every year, less than 1% of them are actually found to be cancerous. I've heard the term squamous cells before. What does it mean? Squamous cells, in the case of a pap test, refer to a layer of flat cells that look like fish scales that line the vagina. When looking at the squamous cells under a microscope, a cytologist is looking for any abnormalities. Does cervical cancer contain squamous cells? Yes. Up to 90% or 9 out of 10 cervical cancers are squamous cell carcinomas. Are glandular cells the same thing as squamous cells? No. Squamous cells line the outer surface of the cervix, while glandular cells line the inner surface of the cervix. Is cervical cancer the only type of cancer a pap smear can find? Unfortunately, yes. Endometrial cancer begins inside the uterus, whereas cervical cancer starts in the cells of the cervix. So even though the uterus and cervix are very close to each other, pap tests aren't usually able to detect abnormal cells in the uterus. However, there are times when a pap smear can show signs of an abnormal endometrium lining of the uterus that in turn can warrant further testing. Are there different categories of abnormalities that can be found from a Pap smear? Yes. The most widely used system for describing Pap test results is the Bethesda system, which contains 3 main categories, some of which also have subcategories. The first and least concerning of all the findings of an abnormal Pap test is atypical squamous cells of undetermined significance. This result means a slight abnormality was found in the cells but did not meet the criteria for a lesion, meaning an abnormal growth. It is the most common abnormal Pap result. Several things can cause this, including a yeast or bacterial infection, but the most common cause is an HPV infection. The second type of abnormal Pap test is atypical glandular cells. This result means that changes have been found in the glandular cells and can signify a more serious issue up in the uterus. Although this result is very uncommon, follow-up tests are recommended for further evaluation. The third type of abnormal Pap test is low-grade squamous intraepithelial lesions, also sometimes referred to as mild dysplasia. This result means a mild abnormality was found in the cells and is usually caused by HPV. It often goes away on its own and is usually not a cause for concern. The fourth type of abnormal Pap test is high-grade squamous intraepithelial lesion. This result suggests a more serious change in the cervix and has as high as a 53% chance of being a precancerous lesion. Without treatment, it is likely to turn into cancer. It is most likely a result of HPV. The fifth type of abnormal Pap test is atypical squamous cells cannot exclude HSIL. This result means some abnormal cells were found that may be high-grade squamous intraepithelial lesion, but further tests would need to be performed to confirm. The sixth type of abnormal Pap test is squamous cell cancer or adenocarcinoma cells. This result suggests a woman is more likely to have cancer or more invasive cancer. Although it might feel a little embarrassing and uncomfortable to go for your annual pelvic exam and Pap smear, it is important to keep in mind the benefits of doing so. And remember that it just might save your life. Learn anything new? I would love to hear about it. Thanks so much for watching. See you next time.